Hello and welcome to our presentation, Christine, Sarah, Kristen and Charlotte for SOC 321 Evidence-Based Practice in Complementary Medicine. Our presentation is 7 stages of a research interview. So our research study topic is inflammatory markers in post-menopausal breast cancer patients, a study of inflammatory Mediterranean diet in the prevention of tumour progression. So this health condition, we're specifically focusing on the consuming of an anti-inflammatory diet to prevent the tumours. Inflammation is one of the leading causes of tumour progression, so it justifies the need to explore this alternative. Previous studies have indicated that the anti-inflammatory diet has positive effects, so it warrants more research in this area. So the what, why and how of our project: thematizing. So the what is the experts in the field can obtain the existing insight of the subject matter that is about to be explored in further detail. Why we're doing this is to describe and define the objectives of the research proposal at hand, and how is understanding that there are various types of techniques and methods that can be conducted to obtain the information around this topic. So how does thematizing relate to our research study? What considers the data and academic research that's currently available, and how this can be used through the consumption of the anti-inflammatory diet. The evaluating and consideration of the consumption of anti-inflammatory may or may not impact the reducing tumour progression for the patients, and the awareness of the various research methods and approaches to analyse the results for reducing inflammation in the breast cancer through the consumption of the anti-inflammatory Mediterranean diet. So stage 2, designing. So this is the 5 stages that we've got for designing. So the overview, so consider the standardised methods of the data collection, so that they don't creep up later within the study. Interdependence, so the decision of various stages can both open and limit what is available in the next stage. Keeping the endpoint in sight, so keep the study's purpose in sight and remember who the actual audience is, who it's intended for. So pushing forward, considering that most of the work at the later stages will benefit from the early stages and the planning so that things stay on track. And then getting wiser, and of course this is to be clear right from the start, because the knowledge gained from the interviews can change the course in the future. So what to consider for our research by the designing stage. So the knowledge gained along the way can change the course of the research, so that's why having a really strong design stage is important from the start. So our research data includes qualitative, like BMI, patient family history of disease and height and weight, those kind of things. The quantitative research includes analysing the elevated CRP and leukocyte levels amongst postmenopausal breast cancer patients. Considering a sample guide to the interview for participants, and keep the importance of having questionnaires in a format that everyone can understand. This is really important. And the last thing is obtaining consent. So when you obtaining consent from the respondents, they need to understand exactly what they're consenting to and where the information is going and why the research information is being collected. So stage 3 is interviewing the respondent. So we're doing a qualitative interview approach. So this includes semi-structured, which is open-ended questions, but they're really easy to be elaborated on. And remembering that it's an evolving study, so the conclusion is flexible, holistic, and evolving throughout the research. So we've got 4 examples of our interview questions that we would put on our questionnaire form. So this is, please describe in as much detail if any foods consumed make you feel better or worse since developing breast cancer. Number 2 is, within a typical week, describe the foods that you would normally consume and any physical symptoms that you've noticed that relate to these eating patterns. Number 3 is, can you elaborate on a particular days or times of the months when your symptoms worsen, and have you noticed any relation to diet? Number 4, would you say that you know the exact elements of a Mediterranean diet and describe it so that we can ascertain that people actually know exactly they're having the anti-inflammatory diet required. Stage 4, transcribing. So the qualitative research requires a careful observation. So the researcher's got to be skilled, trained, and unbiased. The recordings can be done through a written format, audio, or visually, and then coded. Transcription by written form only gives interpretation by the researcher, so audio, recording on a tape recorder or a phone really is ideal. Transcribing again, so our data would be done by a recorded tape. The researcher must be careful to be objective, so not putting their own biases onto the interpretation of the information from the respondent. And they obtain written consent to record the answers for study use. So stage 5, analysing. So the aim of the conducted interviews is to understand the correlation between what participants consume, symptoms, and which may support the idea of the anti-inflammatory diet and the treatment of breast cancer or reducing inflammation within the body. So thematic analysing will be used to explore the transcribed interviews to look for key themes. So the steps in proceeding with the thematic analysis are as follows. So familiarisation with the data. Is number 1. So number 2 is assigning codes to the data. So this can take place during the transcription. It's not an interpretation, but it's what is being said during the interview. Number 3 is sorting the codes, and that relates to the researcher looking for patterns to build the larger themes within the context. And number 4 is review themes. So a link in which the data of the same theme together under a larger theme. This point, hello, Kobe. The researcher will review not only the themes but also the data, and a theme should not become too large to include the data. So defining the names and themes. So this is where the researcher will be engaging, interesting and descriptive. The theme should be defined, why it's interesting and why it's so important. And the last of all is to produce the report. So this has got a clear description of what was done and how. The data collected will be analysed, and the patient's eating habits and their results, their CRP results and leukocytes will be analysed with their consent. So the stage 6 is verifying. So the use of the thematic analysis will assist in highlighting common relationships found between a patient's diet and the inflammation. Thematic analysing can generate generalisability by grouping together similar symptoms and outcomes between the different intervention groups, which may give us the insight that we're looking for. So the ability to form reliable results will be shown when collected data is compared. The outcomes between the similar behaviours, symptoms and foods, and any correlation to the inflammation and the breast cancer patients. The data collected from the participants' interview will contribute to the overall validity of the study. By using this analysis to create the themes, we're showing the relationships between commonalities in the research, which will further assist with the validity of the results of the relevant data. Limitations which we could be looking at could be patient recall, under or over reporting, and misinterpretation by the researchers or unclear answers from the patients. So stage 7 is reporting. The final report should summarise the data and the findings from the interviews through written or oral report. They need to outline the results of the interviews and how this will shape the future of the work. So to effectively communicate the findings, the report needs to meet the scientific criteria, to be ethical and to be respectful to the appropriate audience. Sometimes multiple reports are needed if there are multiple audiences. And the reporting section can include quotations and paragraphs, but the author should always choose the most relevant quotations for the report. So the findings of the study will be easy to read, discussed in depth, to make visible any relationships between the interviewing groups. The methods used will be described in detail and ensure transparency. And we will be including the interview results and the questionnaire results as well. And these are our references. So thank you very much, everyone, and thank you for watching. Cheers.